Hello, welcome to the Terminology Leading Practices stream of the SNOMED CT Expo 2021. My name is Nikki Ingram and I'm a senior terminologist at SNOMED International, and I will be moderating today's session. Please use the live Q&A in the AirTouch device to type your questions to the presenters. All questions will be answered at the conclusion of the presentation. I'm now pleased to introduce Ásta Steinunn from the International Council of Nurses and Jane Miller from SNOMED International, who will be presenting Working Together to Improve Nursing Care, ICN and SNOMED International. Jane and Ásta, please proceed.
Thank you. My name is Jane Miller, and as has been said, I'm at SNOMED International. I work on the collaboration team, and I've been delighted to work with ICN on looking at how nursing can be represented in SNOMED and how we can support nursing globally. Next slide, please. In my presentation, I'd like to talk a little bit about how ICN and SNOMED International have been working together over quite a number of years, and what we've been doing more recently, how we've actually undertaken the work that we've done more recently, and also the benefits, a perspective from both of our organisations on the benefits of working together. Next slide, please. So SNOMED International and ICN really have been working together since 2006, which is a long time. We had formal agreements with agreed deliverables since 2010, focusing on nursing diagnosis equivalence table and a nursing interventions equivalence table for representing Icnp in SNOMED and identifying the equivalent SNOMED and Icnp concepts for those two areas of care. And these equivalency tables were first published in 2016, and we had 6 monthly releases of those tables up until 2018, each time in line with the releases of SNOMED CT international release. Then ICN themselves initiated a review of health informatics globally to identify how they wanted to go forward to their future strategy with regard to supporting nursing in the future. And this led to a new agreement between SNOMED International and ICN. And the key thing here was to integrate Icnp 2019, which is the latest version, into SNOMED CT, and for SNOMED International to produce the Icnp reference set. Next slide, please. So what does that really mean, this new agreement? What does it mean? As I've said, incorporation of Icnp 2019 into SNOMED CT, and then SNOMED International to maintain and distribute Icnp as a SNOMED CT reference set, acting on behalf of ICN. So this is how Icnp will actually be distributed. So ICN, of course, is to retain ownership of Icnp, and SNOMED International to retain ownership of SNOMED CT. And ICN will continue over time to lead on all the Icnp content development and also provide quality assurance of through their own governance processes. And we'll hear more about that from Ásta. But this is key. This Icnp content in SNOMED CT that becomes the reference set has full governance and control by ICN. Within SNOMED CT, we will continue to have other related content relevant for nurses, not just the Icnp content. And the Icnp reference set, the product which is being produced for ICN, will be free for use in SNOMED International member countries and licensed by ICN in non-member countries of SNOMED International. It's a non-commercial agreement, And the first release of the ICNP reference set is this month, October 2021, and then it will move to an annual cycle of release. Next slide, please. So what are the key drivers for SNOMED International and the ICN partnership? Really, it's about ensuring that nursing remains connected to the wider health information landscape globally, to help from the other perspective to ensure that SNOMED CT continues to adequately reflect global nursing practice with that input from ICN to help to ensure we do that. To ensure that information collected using ICNP can link to SNOMED-enabled EHRs, and this is the key thing, to and be shared with other healthcare professionals to support the care of individuals. So this is a key aspect of this, ICNP being part of the EHRs. In addition to capture nursing care in a standardized way, thus avoiding local mappings, and local mappings, as we know, can lead to inconsistency and additional costs if you have to do them every time. And that's both at a local level and for vendors. And then the other aspect, which was a driver and continues to be a driver, is to facilitate the sharing of ICNP-based information to support not just the delivery of patient care, but usage for research purposes and also for participation in health policy making and decision making about nursing and nursing care. Next slide, please. So how have we done this work? We've had a structured program of review to identify additional ICNP 2019 content that needed to be included in SNOMED CT and therefore into the ICNP reference set. And of course, we did have quite a lot of content already there because of having the equivalence tables first, and they have been a resource to actually help to create this reference set. We involved clinical experts from both ICNP and SNOMED CT who actually participated in this independent review, and it was coordinated by ICN and SNOMED International. So examining really whether terms or concepts within ICNP had equivalent terms and concepts within SNOMED CT, and deliberately using the terms there because the key thing was and continues to be about ensuring a common meaning and the same underlying meaning, even if the words might be different, so the terms might be different. So then the group came to agreed recommendations on new SNOMED CT content, also any changes that were recommended for ICNP content, and on any inactivation of SNOMED CT and ICNP content. So this is a piece of work that's gone on over the last year to move us forward. These recommendations from these experts were reviewed by SNOMED International and ICN, and further clarification where required. We've also brought in the SNOMED International Nursing Clinical Reference Group where required, if further validation was needed about the global acceptance of some of the any relevant terms and changes that were being made. We then authored the work into SNOMED CT so that we're aligned fully with ICNP 2019. All this work has been reviewed and signed off from the content perspective and the decisions made by the new ICNP editorial board, which will be discussed by Ásta in a few moments. From there, we've got the creation of the products which are being released this month. The ICNP reference set is the key component which I've just talked about. An equivalence table to enable migration from ICNP 2019 in its format to the ICNP reference set. There's an updating of an ICNP implementation guidance being done by ICN, and our normal release notes, which have been agreed by both organisations, which will go out with the products. All this is being signed off by the ICNP editorial board, and yet again, I'm telling you, this is released this month. The next slide. Distribution and maintenance of this ICNP reference set. SNOMED International is making the products available through the Member Licensing and Distribution Service, MLDS. As we've already talked about, the reference set. The equivalence table we are producing for the migration. This will only be needed for the 2019 version. Release notes. And also in future, there will be a human readable format of the reference set, but it won't be done this time because obviously we have the equivalence table which is human readable. Within the SNOMED CT browser, you will be able to view the reference set in an ontology view. Now, it will only be available through a browser, SNOMED browser, and not in any downloadable form, but that is a key component of this, so that it brings through the ontological principles that SNOMED has got and the benefits of having a reference set from SNOMED. Licensing, as we've talked about, is being put in place for non-member countries by ICN, but products will all be through the same mechanism. And we're moving to annual updates. As you know, Icnp has been available every 2 years. We're moving to annual, and with the content being defined by the ICNP editorial board, and also based on any changes there are to SNOMED CT itself. And again, the editorial board is governing all of that as the owner of the product. The next slide, please. And finally, just picking up there on the benefits of this, what I think ICN and ourselves hope is that there'll be an enhanced reach of ICNP as an integrated part of global healthcare terminology. And then on the other side, reinforcing SNOMED CT support for nursing content as well. The updating and quality improvement of content integration has taken place. Really has ensured that it is relevant for current practice. We hope that by pulling together on this and producing ICNP as an integrated part of SNOMED CT, as well as being able to use it separately, it's avoiding duplication and helping to deliver an integrated resource that supports implementation, both in EHRs and then reusage of data as well. This way, we're able to be more responsive to changes in practice, and also make more visible the contribution of nursing to integrated patient care, so the information will be more readily usable. And for the ontological structure of SNOMED CT, facilitates better analytics for nurses' use and reuse of that data. And we know, as Ásta will talk about, how much this data is actually used in nursing practice. Thank you. Over to Ásta.
Yes, I am the editor-in-chief of the editorial board at ICN, and I will be presenting on the future of ICNP within SNOMED CT and the changes it involves. So really the agenda for my presentation is to talk about the future arrangements between ICN and SNOMED International, the details of it, the ownership and governance of ICNP, and how the agreement will work in terms of the future availability of ICNP nursing content in SNOMED CT. I will also touch on the advantages the agreement will bring to nursing practice globally, nationally, and locally. So for many years, ICN has discussed and realized the importance of having data and information from nursing care and outcomes, and the role Icnp can play in increasing visibility and awareness of the nursing contribution to population health. And these discussions within ICN led to the implementation of eHealth, and Icnp is one of the projects that ICN supports and has increased emphasis on. So there's a special program around eHealth and Icnp. And ICN is committed to continue the development of Icnp and in searching for ways to make the best use of ICN resources and enhance technical support and distribution mechanisms. The discussions led to the possibilities of partnering with SNOMED International, as has already been talked about. And to keep the control of Icnp within ICN, the ICN board established a governance body, which is the editorial board, and which I am representing here. And the members of the editorial board are representatives from all ICN accredited Icnp research and development centers around the world. And the key responsibilities of the editorial board are to serve as the body representing the ICN board, to maintain and manage the integrity of Icnp, to receive and determine the appropriateness of submitted content, and to progress agreed new content or changes to SNOMED International, and to facilitate the implementation and use of Icnp. The Icnp research and development centers around the world are 14 today, and their main role is to lead the ongoing development and growth of Icnp. And the specific role of the editorial board is to receive and review all new nursing content, its relevance to nursing practice and publications. So the review process is currently under development, as the editorial board is a new governance body within ICN. So we haven't finalized that yet. But criteria, or in the review process, we will also attend to and serve as quality assurance of content. And the criteria for submission of nursing content to SNOMED International is being defined, and also how the management of the content will be within the editorial board. And that's actually the discussion of this month. Another role is the sign-off of Icnp SNOMED CT reference set for annual publication. The editorial board members are required to participate in the nursing clinical reference group of SNOMED International. So they have a big role to play in there. And with ICN and SNOMED International partnering, and in the signed agreement between the partners, it is stated that the ownership and control of Icnp remains with ICN. Icnp is incorporated into SNOMED CT, but it will be available as a separate product or a reference set. All new nursing content comes from ICN after being reviewed by the editorial board. And like Jane said, there are no financial benefits on either side. ICN is not getting any money for the nursing content or paying for Icnp to be included in SNOMED CT. By this partnership, the future development of Icnp is sustained, and there is a mutual gain for both. SNOMED CT needs nursing, and Icnp needs SNOMED CT. And one of the benefits of the partnership is access to technical expertise within SNOMED International in the management of Icnp, which makes maintenance of Icnp a lot easier. And this partnership also opens up the opportunity to increase access, distribution, and use of nursing terminology via SNOMED CT locally, nationally, and globally, as ICN has made agreements with 14 countries, and 40 plus countries have license agreements with SNOMED International. And one additional benefit with the partnership is that Icnp can be published or released annually instead of biannually. And the future work of Icnp is huge. The work ahead of ICN and the editorial board is to get to nurses worldwide and increase their understanding of the importance of using the electronic health record to support nursing practice by using structured, formal terminology such as Icnp. Formal terminology is a prerequisite for effective and accurate data capture and sharing. And one way is to strengthen the Icnp research and development centers around the world. And many of the centers have taken a range of approaches to document nursing practice with or by using Icnp, and thereby supporting thousands of nurses around the world in their quest for useful and exchangeable information. The COVID-19 pandemic has highlighted the important contribution that nursing makes to the management of health. It also highlighted the need for very timely decision-making that frequently cannot wait for evidence from research and must rely to a great extent on practice-based evidence. And this reality demands the availability of accurate and relevant data and a nursing workforce that has the skill set to make full use of the resulting information. It is therefore of utmost importance to increase nurses' interest and awareness of Icnp. We need to have the data and information available to improve quality of care, representation on nursing knowledge, and participation in health political decision-making. Icnp is still in development, and some specialties are not as well represented as others. And if a concept is not in Icnp and you need it to document your nursing practice, just ask for it. Nurses globally are encouraged to request new nursing content and send it to ICN. By active participation of nurses everywhere, Icnp becomes the terminology everybody wants and cannot be without. I thank you all for your participation and SNOMED Expo for the opportunity to present at the conference and enable us to introduce the exciting times ahead in developing, implementing, and using Icnp as the terminology in nursing by using SNOMED CT.
Thank you, Ásta and Jane, for your presentation. Can I ask that attendees give us a moment while we switch over from our pre-recorded content so that they can both address the questions you've been submitting live. Please note that this session will be available on the event platform for the next 3 months. Thank you very much. We're here live to answer your questions. If you use the live Q&A in your AirTouch button to type in your questions. I see a couple of questions have come in. The first one, thanks for the presentation. Do you know if there are value sets for subcategories like perioperative nursing?
At the moment, no, there isn't. We've just had the first release, as we talked about in the session. The first release went out last week, and I think that over time, if you're wanting to develop these types of things, you need to contact the ICN editorial board, Icnp editorial board, and identify your requirements for these things. And I'm sure then we can have a look at it.
Thanks, Jane. There's a second question coming from Nick Hardiker. Beyond Q&A and raising awareness and understanding, what now needs to happen in practice environments to ensure that nurses and others realise the benefits of the work? Ásta, are you able to answer?
Do you hear me like this?
Yeah.
Okay. So I think it is also the administration and management of healthcare institutions. They have to realize also the benefits of this work, and that nursing data can be used within their institutions. It is, and also the technical support within healthcare institutions that they need also to wake up and implement. So it's not only it's not sufficient that nurses are aware and understand. They also need the administrations to help them implement.
Yeah, management involvement. Yes.
Mm-hmm.
Another question's coming from Caroline Poulin. Thank you for the presentation. Do you plan to integrate the French translation of the INCP into SNOMED CT? Jane, are you able to answer?
Certainly we wouldn't be doing that internationally, but I think that if there is a French translation, we would be interested. What we said was that as we go forward, the two organizations would talk about managing the translations, because as you know, the translations are done within the countries, then that applies to both SNOMED International and ICN. So we would much prefer to have, where there is a translation going on, that the National Release Centre for a country, for SNOMED, in dialogue with whoever is responsible in that country for the, and I'm sure it's the R&D centres mostly, for the ICMP. And so we would expect to be able to talk together. Of course, France is a slightly different issue because France is not a member country, but I think we would be open to discussion.
Thanks, Jane. We've got a couple of minutes left. There's a question from Charles Guttridge. Do you think health professionals should use the same headings and data fields for recording procedures? Ásta,
I think I can. Yes, I think I see nothing against that. But there are, like, at least from a nursing point of view, there may be two different kinds of procedures. Some are like, if you can say, multidisciplinary, and then there are, like in care plans, the nursing interventions. And sometimes I have the feeling that nurses look at this differently than their co-workers. But I see nothing against nursing going onto the same headlines and data fields as, for example, physicians.
And I think I would add to that I think the most important element is that it's shareable and being shared, so that
Definitely.
we avoid duplication, and also we facilitate speedier care and things.
We've got 30 seconds. Ásta, are you able to say what the next steps are for the development of ICMP?
Well, we need to get to nurses around the world, because we have realized that Icnp doesn't include all the concepts that nursing needs. And there was a question about perioperative nursing earlier. And for example, we need more content in that field and other fields within, or specialties within nursing. So we need to get to nurses around the world to submit new concepts
Yeah,
to be
thank
able
you.
to develop it.
We're out of time, and if anyone has any questions, please go to the meeting hub. And many thanks, Jane and Ásta. Very interesting presentation.
Thank you.
Thank you.